In this video, we will look at the response to the cholera epidemics during the industrial period 1750 to 1900s. So there were four significant cholera epidemics in Britain between 1831 and 1866. Advances in scientific research forced changes in government attitudes towards improving public health by making sure that people had clean water and a hygienic waste management system. So, like sewers, for example. So cholera spread quickly and it affected the poor. So cholera was brought to Britain in 1831 by sailors who arrived in British ports from India. Water became infected by the excrement of people who carried the disease. Most towns and cities did not have a proper sewage system. There were cholera epidemics, so widespread outbreaks, in 1831 to 32, 1848, 1854, and 1865 to 66. Overall, it killed over 100,000 people. So let's have a look then at these beliefs and government responses, both national and local government responses, and how they changed over time. Right, so it's important to remember that government responses changed over time during these cholera epidemics. And I'm going to go through them now. So, 1830s. Let's have a look at the beliefs about disease and its change over time. So people still believed in the miasma theory, which said that the disease was spread by poisoned air and bad smells. The church said that cholera came from God as a punishment for sin. And that is a continuity from previous time periods like early modern, medieval. There was some connections between dirt and disease, but they didn't know about germs. So during the 1830s then, so the Central Board of Health was set up to study the disease in other countries. And there was a National Day of Fasting, Humiliation and Prayer on the 2nd of March in 1832. Right, so to show that people still believed it was a punishment from God. Local areas then, so local governments, there was burning tar in the streets to purify the air, clearing rubbish from the streets to stop the stench, quarantines which stopped poor people entering towns, separate hospitals and graveyards to stop contamination, and health boards to give advice to monitor the spread of cholera. So 1830s, government responses to cholera were very similar to responses to other epidemics such as the plague in the previous time period, in the early modern time period. So moving forward then to 1848, and we see Edwin Chadwick making an appearance here. So thinking about the role of individuals and scientific research. So Edwin Chadwick produced his sanitary report. It contained shocking details on the public health crisis. At a national level, the Public Health Act of 1848 was set up by the General Board of Health and encouraged local councils to set up health boards to clean up towns. However, it was limited. Limited progress because the 1848 Public Health Act did not force change. It was not compulsory. It was permissive. Town leaders thought that change would be too expensive, and if we think at this point in time, the working class do not have the vote. So it is the richer people, middle class, who would be paying for any public health changes from their taxes. This is not going to go down well with people who are voting. So local ratepayers resented an increase in taxation to pay for the act. we're still seeing this idea of laissez-faire, this laissez-faire approach to public health. Next time the date we're going to look at is 1854. So John Snow, so we see John Snow, he proved that cholera was spread by infected water. So he found evidence that a water pump near his surgery was the cause of the disease in the area. However, on a national scale, a laissez-faire attitude still continued, and the General Board of Health was actually abolished. Because John Snow proved that the disease was caused by the water, but he couldn't explain why. So it wasn't until 1861 and Louis Pasteur had proved that germs cause disease. And a few years later, in 1866, the ideas of John Snow were actually widely accepted. Well, that is because of the work of Louis Pasteur, the scientific research he did. He's over here, on my screen on the right, and he proved John Snow's theory correct. So on a national scale, so the Sanitary Act of 1866 made local councils responsible for sewers, water supply and street cleaning. Good sewers limited the impact of the 1866 cholera epidemic because it was a waterborne disease. On a local level, in 1865, Joseph Bazalgette's new London sewage system was opened. This was a really significant part of public health, a significant change to public health, and it revolutionised public health in London. So let's have a look then at these new developments, like the germ theory, which helped to change these beliefs, right? This changing attitude, changing beliefs about illness and disease. So knowledge about how disease spread improved through the work of scientists like John Snow, Louis Pasteur. By the time of the 1866 cholera outbreak, the government was starting to abandon its laissez-faire attitude and introduce new laws to clean up towns and cities. The miasma theory was replaced by the germ theory. This made dealing with the cause of disease like cholera much easier, as the importance of cleanliness became accepted as a way to prevent disease. So let's move away from miasma and religion. The research into how disease spread led to a local and national government focus on providing clean water and good waste management systems, such as the replacement of the midden privy, so a toilet with a pit dug underneath, with a pail privy, so a toilet with a removable bucket. In 1875, a new Public Health Act replaced the 1848 Act. This was really significant in terms of public health. This new law forced local councils to take responsibility for cleaning up their towns, which included the appointment of health inspectors. So the 1875 Public Health Act, so the second Public Health Act, was compulsory. And that's why we see a massive change and improvement in public health coincide with the fact that the working class, most of the working class got the vote as well in the 1860s. So after this, there were no further cholera epidemics in Britain after 1866. It had taken 4 major epidemics and changes in scientific thought to bring about a change in the way that government dealt with diseases such as cholera. Right, so it was a time of huge change, not only in technology and the way that people lived, but also in beliefs and attitudes about the role of government in public health.